Bon après-midi tout le monde. Good afternoon, folks. My name is Maxime Lee, and I will be your moderator for today. Je m'appelle Maxime Lee et je serai votre modérateur aujourd'hui. Merci d'être parmi nous pour ce point de presse. Thank you for joining us for today's media availability. In case this is your first time joining us, to view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located on the top right corner of the Zoom video screen. Si c'est la première fois que vous vous joignez à nous, veuillez changer votre écran au mode Speaker, en anglais, pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin the interpreters, Christopher and Karine, or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes, Christopher et Karine, ou suivre la diffusion sur YouTube. Today, we'll be hearing remarks from the Medical Officer of Health at Ottawa Public Health, Dr. Vera Etches. Also available to answer any questions from the media are the General Manager of Emergency and Protective Services for the City of Ottawa, Kim Ayotte, the Director of Bylaw and Regulatory Services, Roger Chapman, and Dr. Brent Molokny, Deputy Medical Officer of Health at Ottawa Public Health. Aujourd'hui, nous allons avoir la participation de la médecin en chef en santé publique à Santé publique Ottawa, Dr. Vera Etches, et aussi disponible pour répondre aux questions des médias par la suite sont le directeur général des services de protection et d'urgence pour la ville d'Ottawa, Kim Ayotte, le directeur des règlements et des services de réglementation, Monsieur Roger Chapman, et le Dr. Brent Molokny, médecin adjoint en santé publique à Santé publique Ottawa. I will now pass it over to Dr. Etches for opening remarks. Dr. Etches, c'est à vous.
Merci, Max. Et pour tout le monde, bonjour. Thank you for joining us again. It was yesterday that we reported 199 people in Ottawa had tested positive for COVID-19, and today we're reporting 309 people. This rapid increase in people testing positive for COVID-19 is concerning to me. It's Omicron that's present in our community and spreading rapidly. And with other variants of COVID-19, the hospitalizations and death are a lagging indicator where we'd expect to see the impact on local hospitals in the coming weeks. And the best science we have from the Ontario Science Advisory Table is showing, according to their projections, we're on the worst possible curve in terms of where the people testing positive is going, and that it would be followed by hospitalizations that will be hard to handle unless we take action. And as the Science Advisory Table stated yesterday, waiting to take action means waiting until it's too late to take that action as needed. That's why today, as Ottawa's Medical Officer of Health, I am issuing a letter of instruction to businesses with directions for additional and immediate action to further limit the spread of COVID-19 to protect our residents and reduce the potential impact on our healthcare resources and essential services. C'est pourquoi aujourd'hui, en tant que médecin-chef en santé publique d'Ottawa, j'émets une lettre d'instruction à l'intention des entreprises leur demandant de prendre des mesures supplémentaires et immédiates pour limiter davantage la propagation de COVID-19 afin de protéger nos résidents et de réduire l'impact potentiel sur nos ressources en soins de santé et nos services essentiels. So effective Monday, December 20th, 2021 at 12:01 a.m. and until further notice, capacity limits and physical distancing requirements will be reinstated in Ottawa. The following settings will have capacity and physical distancing requirements reinstated to 50%, regardless of requirements to check proof of vaccination. So the impacted settings include meetings and event spaces, including conference centers and convention centers, restaurant bars and other food or drink establishments without dance facilities, personal care services such as hair salons, barber shops, beauty salons, piercing services, and tattoo studios, indoor recreational amenities and indoor facilities used for sports and recreational fitness activities, including areas for spectators within those facilities, indoor clubhouses affiliated with outdoor recreational amenities, indoor concert venues, theaters, and cinemas, museums, galleries, and similar attractions, casinos, bingo halls, and other gaming establishments, indoor fairs, rural exhibitions, festival, and similar events, and faith-based organizations and places of worship. Les endroits touchés comprennent les salles de réunion et d'événements, y compris les centres de conférences et les centres de congrès, les restaurants, les bars et autres établissements de restauration ou de boissons sans salle de danse, les services de soins personnels tels que les salons de coiffure, les barbiers, les salons de beauté, les services de perçage et les studios de tatouage, les installations récréatives et antérieures et les installations antérieures utilisées pour les sports et les activités récréatives de remise en forme, y compris les zones réservées aux spectateurs dans ces installations, les pavillons antérieurs affiliés à des installations de loisirs extérieurs, les salles de concert, théâtre et cinéma antérieurs, les musées, les galeries et les attractions similaires, les casinos, les salles de bingo et autres établissements de jeux, les foires, les expositions orales, les festivals et autres événements similaires se déroulent à l'intérieur. So the total number of members in the public permitted to be in an indoor portion of the space at any one time must be limited to the number that can maintain a physical distance of 2 meters from every other person in the business or facility. In addition, these spaces must not exceed the 50% capacity. So there will be additional requirements for businesses and organizations that serve food and beverages. These new requirements include that the patrons must be seated at all times when consuming food or drink, and no more than 6 individuals are allowed per table. Il y aura aussi de nouvelles exigences pour les entreprises et les organisations qui servent de la nourriture et des boissons. Les nouvelles exigences sont les clients doivent être assis à tout moment lorsqu'ils consomment de la nourriture ou des boissons, et un maximum de 6 personnes est autorisé par table. In addition to the guidance set out in the letter of instruction, Ottawa Public Health is calling on all local employers and businesses to support employees working from home, if possible, and not to ask employees to return to a physical location for the time being. More details regarding the letter of instruction are included on our Ottawa Public Health website. Vous trouverez plus de détails concernant la lettre d'instruction sur le site web de Santé publique Ottawa. We are anticipating hearing more from the province this afternoon. We've seen the announcement of the 3:30 press conference, and so we will provide further updates to Ottawa residents if the situation is changing. Certainly, if the province comes out with similar recommendations, that's positive. We think they're needed in Ottawa. That's what I'm speaking to today. And if there are more restrictions, that the stronger the measure will apply. So further to the letter of instruction, just take a sip of water. As your medical officer of health, I am asking each and every resident in Ottawa for their cooperation in the coming weeks. So I'm strongly recommending and I'm urging that people in Ottawa keep your gatherings as small as possible, to limit the number of people that you come into close contact with, to suspend participation in all indoor sports and team play for the time being, and not to attend large venues, to avoid crowds. And if you do choose to attend an event that's large, wear a mask at all times. Gardez les rassemblements aussi petits que possible. Limitez le nombre de personnes avec lesquelles vous êtes en contact étroit. Cessez pour l'instant de pratiquer tous les sports d'intérieur et de jouer en équipe. Ne fréquentez pas les grandes salles et évitez les foules. Et si vous décidez d'assister à un événement, Portez un masque de haute qualité en tout temps. It was an extremely difficult decision to issue a letter of instruction at this time, knowing all that people have been through, and there are significant impacts for businesses and individuals with this measure. We know it will cause additional stress during one of the busiest times of the year. So we ask for everyone's cooperation to support businesses and employees and patrons during this stressful time. You can support them through virtual purchases or other measures. That is really appreciated. And I recognize that there are significant delays also on another subject of being able to access testing. So the spread of Omicron has overwhelmed our testing resources in the region. The testing task force and our hospital partners, they're working diligently to develop solutions. However, the testing capacity will not keep up with COVID-19 as it grows like this. So we don't need a test to protect others. If you have symptoms, you can assume that you have COVID-19 and self-isolate. That will protect others from COVID-19. And similarly, household members need to isolate, regardless of their vaccination status. If you've been tested and you're waiting for test results, please isolate until you receive a negative result. Do not attend school, sports, or extracurricular activities while waiting for test results. Interacting with others and not following public health guidance has significant ripple impacts on others in the community. So in addition to taking these actions, we are still, of course, encouraging people to get their vaccines, first, second, or third dose. And we know the demand is extremely high. So we're doing everything we can to open up more appointments, increasing our capacity. We want to vaccinate everyone who's eligible as soon as possible. En plus de ces mesures, nous continuons à encourager tout le monde à recevoir la première, deuxième ou troisième dose de vaccin. Et nous savons que la demande est extrêmement élevée et nous faisons tout notre possible pour offrir plus de rendez-vous, augmenter la capacité et vacciner toutes les personnes éligibles le plus rapidement possible. So to date, it's over 121,000 doses, third doses to be clear, have been administered to Ottawa residents. And on Monday, it's another 634,000 people in Ottawa, 18 years and older, will be eligible for a third dose. So we can't completely immediately meet this demand, but it does give me great hope that many people are actively seeking to protect themselves and their family, and that we have a strong team working on growing capacity each day. So we're asking residents of Ottawa for their patience and their understanding as we work through this weekend and the following days to meet this demand. The reality is on Monday, we may not have a lot of new appointments for the newly eligible 18 plus population. There may be no or very few appointments available, but please follow Ottawa Public Health announcements on our website and our social media for the latest information on available appointments. Nous demandons aux résidents d'Ottawa leur patience et leur compréhension de cette fin de semaine et dans les jours suivants, alors que nous travaillons aussi vite que possible pour répondre à la demande. La réalité est que lundi, pour la population de 18 ans et plus nouvellement admissible, il n'y aura probablement pas ou très peu de rendez-vous disponibles. Veuillez suivre les annonces de Santé publique Ottawa sur notre site web et sur les médias sociaux pour obtenir les dernières informations sur les rendez-vous disponibles. My understanding is that the supply distributed to pharmacies is growing next week. The pharmacies will have more supply. So I acknowledge this is all difficult news to hear. It's difficult to announce. If you are struggling or you need someone to talk to, I encourage you to reach out. There are resources in the community available to help you 24/7. Please don't give up, Ottawa. We worked so hard over the past 2 years to help keep each other safe. And as individuals, we do have control over the choices we make. We are not helpless in the face of Omicron. And this surge, like others in the past, will come and go, and we'll make it through. But please take care of yourself and others during these difficult times. Whenever possible, find the time to help each other smile, reach out to those you love. we are tougher than we think. We will make it through this wave. Prenez soin de vous-même et des autres en ce temps difficile. Dans la mesure du possible, prenez le temps d'aider les gens, de sourire, de tendre la main à ceux que vous aimez. Nous sommes plus forts que nous le pensons et nous réussirons à traverser cette vague. So thank you. Merci.
Okay, thank you very much, Dr. Etches. Merci beaucoup. Before moving on to questions, I would just like to remind folks that we have General Manager Ayotte, Director Chapman, and Dr. Malakny available to answer any questions as well. Avant de continuer, juste un rappel que nous avons le directeur général Ayotte, le directeur Chapman, ainsi que le Dr. Malakny de disponibles pour répondre aux questions aussi. I will now invite each media agency in alphabetical order to ask their questions, and please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique, et chacun pourra poser une question ainsi qu'une question de suivi. We will start with the Barrhaven Independent, Charlie Sinak. Charlie, over to you.
Good afternoon, Mike Etches. I was hoping you could talk a little bit about the possibility of schools reopening in Ottawa come January. We've seen so many parents this week. I know I've personally received countless emails from parents saying that they would not be sending their children to school this week. They just did not think the risk was worth it. We know here in Barrhaven, there's been a number of schools which have had outbreaks. It really seems we are almost kind of in the worst stages of this pandemic in some ways. How likely is it, do you think, that schools will reopen here in Ottawa come January?
So what I want to start with is thinking about how different this fall has been compared to most of the school year in 2020-21 when we had complete closure of schools for long periods. We were able to avoid that this fall. Certainly, though, it's been very hard on families because they have had the highest rates of COVID in the community in the 5 to 11-year-old age group. So they've had to have repeated testing, and there have been cohorts sent home and schools closed, and this is hard. The priority has been to keep schools open, to take this approach school by school, class by class. That's what we're planning for January. We're planning to be able to keep the schools open across the board and then react and act as early as we can where we need to. And we have some new tools, right? So in Barrhaven, where the rates have been some of the highest in the community, there were schools that we were able to try using rapid antigen tests in to keep an eye on what was happening. Every school student this holiday will have some of those rapid antigen tests to be able to keep an eye and see, is COVID there? And that's what we're hoping with a greater supply of rapid antigen tests coming in the new year. We hear that we'll have these tools to help. What we also know is that schools are a very structured environment where it's a place that people are just with one group, and they have masks on, and they've maximized the ventilation, and we have concerns with the kind of congregating and gathering and mixing of students outside of school that we can see, has led to transmission then that enters into school. So my hope and my recommendation, strongly right now, is that parents would prioritize school and pause the extracurricular activities, pause the indoor sports with others, pause the activities where people are in close contact with others, that will make it more possible to keep schools open in January. And of course, we have to keep assessing. At this point, we're assessing day by day. The COVID rates are growing so quickly. So we know, again, parents will need notice if things are going to change. We will let them know as soon as possible.
Thank you. And follow up?
You mentioned, Barrhaven, a hot spot the past 30s. for COVID-19 infections. I know as of December 6th, in both the 14-day and 30-day trends, Barrhaven had, in some cases, almost triple the city average for number of COVID cases. I'm wondering if you could tell me a little bit about why this is and what types of settings you were seeing in the community which really led to so many cases of COVID-19, and if we're starting to maybe see that get a little bit better now that the school outbreaks seem to be getting under control. Some of the business outbreaks are also getting under control. What caused all of this, and do we seem to be seeing a bit of a curve in the community?
Yeah, I think it shows us that our actions matter. When we stop giving COVID the option to be transmitted, it works. So where COVID is transmitted is in indoor environments, mostly where people are in close contact and they're not distanced and they're not wearing a mask. And so those are often social environments, often in people's homes. Often we are seeing some types of sports activities. The masks come off, people are in close contact. So those are things we can pause, and we need to pause right now. And that makes a difference. So I think the other thing I didn't say about keeping schools open is, again, parents haven't felt this yet, but it's coming. We have now been vaccinating a good proportion of people 5 to 11. That's 50%. We definitely need that to go higher to have the maximum benefit. But they will have a second dose in the new year. And we see the difference that makes when you take a look at the secondary schools. The number of outbreaks in secondary schools has been really low in comparison to elementary. And that's where we're going. With elementary students, they'll be able to have that same protection as secondary students. And we expect then, also to have fewer outbreaks.
Thank you, Dr. Etches. Thank you, Charlie. Next up, we go to CBC Ottawa, Nicole Williams. Nicole, over to you.
Thank you. I believe my question is for Dr. Etches. I'm wondering if you can just first clarify the difference between, I guess, a letter of instruction and a Section 22 order. I guess I just want to understand if this letter of instruction to businesses, are these legally binding? And if that's the case, how will they be enforced?
Yes, a letter of instruction is legally binding. It's under the Reopening Ontario Act. And so the enforcement is the same as other regulations written under the Reopening Ontario Act. In Ottawa, certainly happy for my colleague Roger Chapman to speak to this. Our bylaw officers have been doing very much the enforcement work, and we're very thankful for that. It's always a discussion with people to help them understand and bring people along. Our Ottawa Public Health team will also we have been connecting with businesses to help them understand what does this mean for them. We have a lot of information for businesses on our website to update and clarify the recommendations right now and the requirements, legal requirements now under this letter of instruction. The Section 22 order is different. That's something a medical officer of health can issue under the Health Protection and Promotion Act. And it doesn't have the same kinds of options for enforcement in the same pathways that make it as easy as under the regulations for Reopening Ontario Act. So this is the preferred mechanism.
Thank you. I don't know if anyone else wanted to add anything to that. I know you mentioned. No, we're good. Okay. I'm also wondering, I know this is not the news you wanted to be giving today. And I guess I'm just wondering why there's why there are no measures against personal gatherings. I'm wondering if you could just explain the decision there.
I actually can't include limits for private residences in a letter of instruction because, again, the regulations are set up that they're for businesses and in enterprises that run businesses. So there's not a capability for me to do that under this letter of instruction. So my advice, like my best advice and strong recommendation, is that people limit their gatherings to as small as possible. To limit your contacts in every instance that you can, and that definitely includes a strong recommendation to cease the team sports and the indoor sports at this point.
Thank you very much. Next up is City News Ottawa, Alex Gouge. Alex, over to you. Are you there, Alex? Okay, well, we might come back. We'll go to CTV News Ottawa with Josh Pringle. Josh, over to you.
I could add in Alex's hello if you'd like to make it feel like he is here. My question for you, Dr. Etches, we are hearing reports that the Premier is going to make an announcement in about an hour from now. Do you have would you like to see a limit on indoor private gatherings of 10 people or fewer like we've seen in Quebec and we've seen in other jurisdictions moving into the holidays?
I do think that could help because, businesses, again, really do appreciate the restaurants, the bars. They've tried their best to make things as safe as possible, right? With masks, with distance. They're working so hard at that. And in social gatherings inside private dwellings, there isn't necessarily the same attention to masking and distancing. So the best way to limit COVID transmission is with smaller numbers. So 10 is reasonable, but it really shouldn't be a target. It should be a maximum, and the smaller the better.
And I guess my follow-up question, either for you or it might be for Mr. Chapman or Mr. Ayat, will bylaw be deployed starting on Monday to go into bars and restaurants and other settings to make sure that they are following the rules moving forward?
I can answer that and pass it on to Director Chapman as well. But yeah, bylaw is always at the ready to go and enforce the laws. So we respond in both, to complaints. If anybody has specific complaints with regards to observations that they're making, they can call 311 and then bylaw will respond. And then we will set up task forces and strike teams to go and check it out. We just we don't advertise those, but I'll let Roger speak to that.
Yeah, thank you, Kim. I think that pretty much covers it. I was just going to add that, yeah, the dedicated team will be redeployed starting Monday. So, but primarily we're responding to complaints and information received from the public for non-compliance, and that's where we'll continue to focus our efforts in those areas.
Thank you very much, everyone. Just looking back, Alex, City News, are you there? Well, I might come back to you at the end then. Next up, Global News, Craig Lord. Craig, over to you.
Hello. I'm wondering, Dr. Etches, you mentioned asking people to stop their participation in sports as much as possible. Why, I'm curious, kind of message it like that, asking people to voluntarily cut down rather than maybe put limits on certain sports venues and organizations in Ottawa?
Yeah, so this may be needed. This was the collection of recommendations that we came to at this point. I would say this is a minimum, and we're going to be continuing to review this.
Thanks. And you also mentioned, I guess, setting expectations for the 18 plus crowd to get booster shots. I'm curious, you said yesterday there's about 750,000 people in this age group, and that everyone will get a booster, when they want one. But what timeline do you think is realistic for most of that age group, the 18 and older in Ottawa, to get a booster shot? Is it early next year or a little bit later, or do you have any expectations? I know you're constantly trying to add those resources, but could you give us any timeline now for when people can expect maybe to be able to book an appointment? Right.
So I don't know if I said when they want one, because I know a lot of people want one yesterday. So that's not quite accurate, but we will be working to make sure that everybody gets one who wants one. the population, I guess it was eligible for third doses, I'd said was 750, but we have given 121. So that's good. That's 1,000. That's a good start. But we think that working through access for the 600,000 plus, it will take a number of weeks. We are going to try to shrink that as much as we can. So we haven't put a limit on how many doses we'll give a day. We doubled them this week. We're looking to keep growing that. And we're in conversations with the province to really take some novel approaches about finding immunizers. And it really is the people who can immunize that is limited at this point. But we're looking to see how we can overcome each and every barrier to speeding up the vaccine program.
Okay, thank you very much. Nous allons maintenant passer à le droit avec Annie-Rose Deschâtelet. Annie-Rose, c'est à vous.
Merci beaucoup. Dr. Etches, vous en avez parlé un petit peu tantôt. Là, les commerçants, les restaurateurs font beaucoup d'efforts là, depuis le début de la pandémie. Vous leur répondez quoi justement à ceux qui disent que les établissements comme les leurs, c'est peut-être pas la bonne cible à pénaliser, entre guillemets, là, puis que la propagation se fait davantage dans les rassemblements privés? Là, il y en a plusieurs qui trouvent qu'on les punit pour rien.
C'est un temps pour tout le monde d'aider avec le tâche de diminuer la transmission de COVID-19 dans notre communauté. Alors, c'est chaque personne et toutes les entreprises qui a un rôle. Ça peut faire une différence. C'est urgent aujourd'hui de changer la vitesse de transmission parce que l'avis, la séance que nous avons, c'est que les hospitalisations vont suivre. Alors, c'est important de réduire le nombre de contacts et c'est nos décisions individuellement, mais c'est aussi dans les espaces comme ça.
Merci. Puis, en question de suivi, il y a un petit peu de confusion là, au niveau de la disponibilité des tests rapides ce matin à la LCBO, mais il y en a eu quelques-uns qui ont reçu leur test. Puis ça a été, tout est parti en fait en quelques minutes. Est-ce que ça vous encourage que les gens qui ont l'intention justement de se réunir pendant le temps des fêtes ont répondu à l'appel et ont l'intention d'utiliser les tests rapides justement?
C'est encourageant qu'il y a intérêt de limiter la transmission de la COVID-19 et peut-être d'avoir un dépistage rapide comme ça, c'est avec l'intention de limiter la transmission de COVID-19. Parce que c'est pas la seule solution. Je voudrais rassurer la population que quand les dépistages rapides ne sont pas disponibles, la quantité est limitée. Ça n'arrête pas la possibilité d'utiliser les mesures de limiter la transmission de la COVID-19. Je m'excuse, c'est clair, si on a des symptômes, on peut rester chez eux en isolation pendant les 10 journées. Ça peut aider de diminuer la transmission aussi. C'est un environnement maintenant où tous les différents types de dépistage sont moins accessibles. Et je voudrais aussi demander à la population de n'attendre pas pour un dépistage, mais isoler quand vous avez des symptômes. Parce que c'est probablement Omicron, c'est important aussi pour les contacts étroits d'isoler aussi. N'importe quand leur vaccination, leur statut vaccinal, parce que Omicron a aussi causé des infections dans les populations immunisées. Heureusement, probablement, avec moins de sévérité. Ça, c'est l'idée de protéger la population avec la vaccination. Malheureusement, c'est moins efficace contre Omicron. C'est aussi pourquoi on demande et on travaille fort d'augmenter la capacité pour les troisièmes doses.
Merci beaucoup.
Merci beaucoup. Next up, we go to the Ottawa citizen, Elizabeth Payne. Elizabeth, over to you.
Thank you. Thank you. This is a question for Dr. Etches. Yesterday afternoon, about this time, you talked about being in talks with the Chief Medical Officer of Health and with the province. I sensed from you, or perhaps you said directly, that you would have preferred action from the province because this is a provincial issue. What happened? Did you not hear back? Are there areas that you both have to act on? It's a bit confusing to see this announcement come from OPH when we've got something coming from the province, we think, soon.
So in conversations with the Office of the Chief Medical Officer of Health, I did get support to implement these measures that I think are needed in Ottawa. And I don't have confirmation of what the province will announce. Certainly, if they're implementing similar measures, I'd be very thankful that they're reinforcing the message and what is needed.
Okay, thank you. This isn't a follow-up question, but I just wanted to clarify that they do not notify public health units in advance of this announcement.
I think that they're having a teleconference that began at 2:30 with medical officers of health. The Office of the Chief MOH is meeting with medical officers of health just right now. So I have a colleague on that call, and we'll find out. But I didn't have prior information.
Okay, all right. And as a follow-up, I'm trying to clarify some of the messaging on testing now. If testing, I think you're saying it is now overwhelmed. Are you telling people not to go for PCR testing? Is that going to be limited to priority groups at some point soon? It's not limited to priority groups right now, but there are discussions about if we need to move in that direction, which groups would be prioritized for PCR testing. And what we're seeing right now is that some people are waiting 2 and 3 days to get an appointment for a PCR test. And so I don't want people to wait and not isolate, or have had their test result and it's taken, and then it's taking a while to get the result back, and sort of just give up and go out there as if it's not Omicron. What I'm asking people to do is treat it as if it is Omicron, even without a test. And please isolate when you have those symptoms, and speak to the members of your household about isolating as well. Okay, thank you.
Thank you very much. Next up, we go to Ottawa Sun, Jackie Miller. Jackie, over to you.
Thank you. Could you please clarify your remarks about what power you have to enforce indoor gathering limits? You mentioned that you can't do that under a letter of instruction. Can you do that, though, under a Section 22 order? Because other medical officers of health have done so. In Kingston, for instance, I think the gathering limit is now down to 5 people. And would you doing that?
That is true. I think technically possible under the Health Protection Promotion Act, if the situation warrants it, that we have to prove there's a concern about a communicable disease in the community, which I have, and meet certain requirements, and then that's possible. The challenge with the Section 22 order comes around the enforcement and the difficulties with that. So again, I don't think there's a magic number for decreasing. I mean, under 10 is really helpful, and the smaller the better is my best advice.
Okay, thank you. And just to follow up on the testing, you said that if you have any symptoms at all, isolate yourself and wait until you can get a test. Can you just clarify for us what the current symptom list is? Are the symptoms different under Omicron? It's hard for people to keep track. I mean, is it a runny nose, a headache, a scratchy throat? If you could just clarify that, and that all your household has to isolate as well.
Yes, so the symptoms that could be COVID, most commonly it appears with Omicron right now would be fever and muscle ache. Absolutely other symptoms that people have of respiratory illnesses like a cough or a sore throat. These runny nose, yes. So any of these symptoms, and Ottawa Public Health does keep our website up to date. I'm sure there have been little slips here and there, but you can go to Ottawa Public Health website for a list of COVID symptoms that as a reminder of what's there. And when I say yes, the household also, it's because of Omicron. And what we're seeing with Omicron is that previously, when a close contact, a household member of someone who tests positive
fully vaccinated, we could have some confidence that that vaccination wouldn't result in transmission, that vaccinated person could simply monitor for symptoms and get tested if the symptoms developed and isolate when the symptoms developed. Things are happening faster and they're spreading to people who are vaccinated with Omicron. And so the best way to try to limit transmission is to take that action as a household.
Thank you.
Thank you very much. Nous allons maintenant passer à Radio-Canada. Frédéric Pépin. Frédéric, c'est à vous.
Merci, Maxime. Docteur Etchez, j'aimerais ça peut-être vous entendre à nouveau là-dessus, là, sur ce que vous avez recommandé pour ce qui est des actions que les gens doivent prendre. Vous, dans vos mesures aujourd'hui, vous parlez beaucoup des commerces, mais les gens à la maison devront aussi faire leur part. Qu'est-ce que vous attendez d'eux?
Première chose, c'est limiter le nombre de personnes avec lesquelles vous êtes en contact étroit. Incluant en cette action, c'est garder les rassemblements aussi petits que possible. Un peu nouveau, c'est cesser pour l'instant de pratiquer tous les sports d'intérieur et de jouer en équipe. C'est mon meilleur avis. Et ne fréquentez pas les grandes salles et évitez les foules. Et si vous décidez d'assister à un événement, portez un masque de haute qualité en tout temps. Alors ne bois pas ou ne mangez pas pendant beaucoup de temps.
Docteur Etchez, maintenant, la province va faire une annonce cet après-midi. Puis je me rappelle, je vous demandais la question hier. Là. Je vous demandais si vous pensiez que si vous alliez attendre après la province. Évidemment, aujourd'hui, vous n'attendez pas. Vous agissez. Mais là, la province va annoncer d'autres choses. Est-ce que la province de l'Ontario va trop lentement, selon vous?
C'est juste que j'ai besoin de faire l'action que je peux voir est importante pour Ottawa. Alors, c'est pourquoi nous avons préparé cette lettre d'instruction. Et je suis encouragée que la province a une annonce aujourd'hui, mais je n'ai pas d'informations concernant le contenu. Alors, c'est important pour moi d'informer la population et oui, c'est un peu difficile d'attendre pour la fin de l'après-midi sur un vendredi. Alors, c'est pourquoi maintenant. Mais je pense que c'est possible que nous sommes dans le même train avec le même avis pour la population.
Merci, Dr. Etchez.
Merci beaucoup. Our last question comes from Your Community Voice with Patrick Uguccioni. I'm sorry. Go ahead, Patrick.
My question is around the appointments. Earlier you said there's over 600,000 people coming up eligible on Monday, and there will be few or no appointments. Why is that? Is there no supply? Is there not enough people to put the needles in the arms? Not enough venues? What is the issue there?
So we understand from the province that there is a lot of supply of the mRNA vaccines in Ontario. We probably have a lot more Moderna than Pfizer supply, but that's good. Either Moderna or Pfizer, they're both mRNA vaccines that will provide good third dose protection. And so no one needs to worry about supply. What we are limited by at the moment is that giving a vaccine is a regulated, an act that's regulated. So it has to be done by a regulated health professional. So we only have so many regulated health professionals that are able to immunize. And we're calling on them. And we've added them to the teams in the mass vaccination clinics. Our hospital partners have stood up more clinics. Our family physicians are coming out to the EY Center this weekend. Paramedics are helping. So it's a matter of being even more creative. How can we go further? We have nursing students, medical students, like many different people. We are exploring with the province how to grow the pool of immunizers, and it really is the limiting step. But we'll keep adding appointments to the system as that capacity grows. And I know people are treating this as an emergency task. They're treating it as getting it done as soon as possible. I think why you see me announcing measures today is of course, it can't be all done at once. And of course, unfortunately, with the spread at this rate, it's not enough and it's not fast enough to rely on vaccination.
And just one follow-up question. I think you mentioned whether it's Moderna or Pfizer, they're really both the same. It's the same thing. So if somebody had an AZ and a Moderna, they should take either the Moderna or the Pfizer, whatever's available.
That's correct. Yeah, for a booster dose, either Pfizer or Moderna, they're interchangeable in terms of whatever your previous doses were.
Thank you very much.
Okay, thank you. There you have it, folks. Lots of valuable information shared here today. We appreciate your help in getting the information out there. I know it's not easy, but the role that you have is very important. For that, we thank you. And keep on keeping on. Beaucoup d'infos aujourd'hui. Merci aux médias de votre soutien. C'est grâce à vous que l'on peut diffuser cette information. Et je sais que c'est pas facile, mais un gros merci. Beaucoup. C'est tout le temps qu'on a aujourd'hui. That is all the time we have for today. See you next time. À la prochaine.